I'm Dr. Leo Powers, and today we're going to talk about migraine headaches and how to correct them. There are chiropractic, natural health ways to correct headaches. There are many different kinds of headaches people have. There are tension headaches, migraine headaches that tend to be on one side, cluster headaches, jaw pain headaches, sinus headaches, hypertension headaches. So today we're going to talk about the migraine headaches, and they are right here. And so to understand this, it's best to understand that part of the stress to headaches comes from category 2 stress. And category 2 is one of the 3 categories in sacrooccipital technique. And the category 2, the sacroiliac, is loose back here, and so it slides back, and so you get pain down the side of the leg, front of the leg, to the groin, medial knee and ankle and foot, shoulder and arm symptoms, lateral side neck pain, lateral side headache. And the organs connected to category 2 stress are the liver, the pancreas, and the adrenal system. And when you have liver, pancreas, and adrenal stress, it can be related to low blood sugar. And when you get low blood sugar to your brain hurts and it doesn't feel good. And there are some nutritional components to it. So like refined carbs, sugar, white flour, alcohol, those are all carbs, basically. And sometimes you got to cut back on your carbs in order to help with the headaches. Sometimes you don't have to cut back on the carbs, but you got to change the ones that are like the sugar that are unnatural sugars, like corn syrups that has, or high fructose corn syrup, because it has sulfates in it. And the sulfates can aggravate headaches because it stresses the liver. You're not supposed to have sulfates in you, or most people are, sensitive to that. And I myself had migraine headaches when I was growing up, and then when I'd go to town and get some candy or some donuts that had the filling in there, and ate 3 or 4 of them, I'd get an awful headache, and then I didn't like the headache, so then I finally realized that it was the candy and the other stuff that was doing it. So then I cut back on my candy. I could still have my mom's pumpkin pie, and it had sugar in it, but it didn't give me the headaches. So it was the sulfates that was causing the problem. Later I learned that I needed to cut back on pies, but initially I could have pies and it didn't give me any headaches. So, I mean, if you're just worried about the headaches, it can just be choosing to get like jams and jellies that have real sugar, not corn syrup in there, or high fructose corn syrup. It's in lots of other foods too, other candies, cookies, trans fats, that's the fats that are hydrogenated. Sometimes that causes a problem. So if you go with God food, how God made it, and don't adulterate it, and God made sugar too, so as long as you don't have a lot of it, it could be okay, for headaches. So basically, the other thing that causes stress to the liver would be monosodium glutamate. That's in it's additive in some foods that can give you a MSG headache. So basically, the CSF needs to come down when you breathe in, and it needs to come back up when you breathe out. And then I did go over connection to the gluteal muscles, which are other side of this one. Just right here. There's 3 gluteals that connect with that. The one brings the CSF down, and the 2 bring it up. And then the other part is the toe in, toe out that tie in with the hamstring, the auditory and visual component that's in the connections after this YouTube video. And so there's optic chiasma, it ties in with the hamstring muscles, move with the optic nerve. And then the hand and foot bone connection, there's this is yang and this is yin, and the yang and the yang is over here, and the yang what's in the yin, the hand bone is right here. And then you can just one head bone adjust. adjustment for the yang component, and then you can do the yin component. So basically, it's fairly mechanical and simple. Different people have different amount of stress in the different gluteals or toe in and toe out, and the also the category 2 components. And so basically I would check to see where your strengths and weaknesses are, and then work on to build weaknesses into strengths so that your migraine headaches can go away and hopefully they don't come back. And you won't necessarily need to keep coming for treatment, because if we fix what needs to be fixed and then you do some exercise and eat God food, it could be really nice not having headaches, which that's what I attempted to do when I was growing up, and different things for different people to correct it. So we're Powers Chiropractic in Plover, Wisconsin, and you can call it 715-341-7102 if you need further information or if you want to make an appointment.
I'm a patient of Dr. Powers, Powers Chiropractic, and I've had migraines for 35 years. I'm 66 now, and I had them starting out around once or twice a month. And when I first saw Dr. Powers, I was having them up to 3 times a week. And now I haven't had a migraine since 7 weeks ago. And I will have mild ones, but those migraines are gone, and I'm very appreciative.